strategies for building resilience, and actions you can take. The World Health Organization defines resilience as the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family or relationship problems, health problems, workplace stress, and financial stresses. Each person's capacity to demonstrate resilience is based in part on the circumstances and other factors that are often outside of their control. If you're more sensitive to emotional distress and are finding it difficult to cope with hardship or adversity, it's important to remember that we all have a limit to what we can tolerate. This needs to be acknowledged so we are better able to accept when we have reached our limit and don't consider ourselves a failure. Some strategies you can undertake. Make connections. Strong social support networks, family and connections are associated with resilience. Connections provide access to varied types of support, both practical, informational and emotional. Relationships that create trust, provide role modelling and offer encouragement and reassurance help strengthen a person's resilience. Give yourself time. When we are often faced with adversity, our first response is often to try and hide our feelings. When feeling like you're unable to cope, try reaching out to a friend, family member, colleague or your doctor. Express your feelings. Give yourself time to think, process information and absorb any associated shock. Mind your thoughts. When your inner conversations are self-defeating and critical, it creates self-doubt, fear, anxiety, procrastination, and often depression. Thoughts are the mental link to the environment that allows you to assess your situation in order to make choices that allow you to survive and thrive. If our thoughts are pleasant, our bodies will secrete chemicals such as oxytocin, serotonin, and dopamine that create a sense of relaxation and well-being. If you feel stressed, then your thoughts will create a chemical environment consisting of adrenaline, cortisol, histamines, cytokines, and other hormones that create a sense of insecurity and dread. It's important to ask yourself, is this thought true? Is this thought important? Is this thought helpful? It is important to recognise that how an individual thinks about an event or situation will affect how they feel and what they do. Resilient people are able to mentally take a step back from challenging circumstances, accept the negative side of things, whilst finding opportunity in the midst of adversity. Self-criticism versus self-compassion. We often believe that self-criticism and self-punishment will drive us to perform better. However, harsh inner self-criticism, especially in time of hardship and disappointments, can create a war within, which causes anxiety, depression, and other mental health issues. Self-compassion involves being caring and compassionate to oneself when faced with hardship or adversity. Self-compassionate individuals are less likely to ruminate about unpleasant self-evaluations. Some resilient actions you can take. Move towards your goals. Develop realistic goals that enable you to move forward. Ask yourself, what's one thing I can do today that will help me move in the direction I want to go? Take decisive actions. Act on adverse situations as much as you can. Take decisive actions, rather than detaching from problems and wishing they would just go away. Nurture a positive view of yourself. Develop confidence in your ability by identifying your strengths. Keep things in perspective. Even when facing very painful events, try to consider the stressful situation in a broader context and keep a long-term perspective. Learn from experience. Think of how you've coped with hardships in the past. Consider the skills and strategies that have helped you through these times. Whilst everyone is resilient to some degree, no one is perfectly resilient in all circumstances, because anyone can be overwhelmed when circumstances are severe enough. Resilience is not about toughing it out, being stoic, or going it alone. In fact, being able to reach out to others for support is a key component of being resilient. It doesn't mean you won't experience adversity, however, employing these resilient strategies can help you cope with difficulties when they arise. Resilience can help protect you from various mental health conditions, such as depression and anxiety, and can also help offset factors that increase the risk of mental health conditions, such as previous trauma. Becoming more resilient does take time and practice, and if you don't feel you're making progress, consider talking to a mental health provider or your general practitioner.